Welcome to A to Z Medway channel. Today we are going to discuss everything you want to know about heart sounds. First we can talk about some basics. Our heart has 4 sounds, they are S1, S2, S3, and S4. S1 and S2 are high-pitched sounds, so we need diaphragm of the stethoscope to listen to it. S3 and S4 are low-pitched sounds, so we use bell to hear the sound. Also remember, ventricular systole occurs between S1 and S2, whereas, ventricular diastole between S2 and S1. Auscultation areas. Aortic area. It's on right second intercostal space, near sternal border. Pulmonary area. On left second intercostal space, near sternal border. Erb's point, on left third intercostal space, near sternal border. It's a good location to hear sounds of aortic and pulmonic origin. Tricuspid area. It's on right fifth intercostal space, midclavicular line. Mitral area, on left fifth intercostal space, midclavicular line. Let's discuss more details about each heart sounds. First heart sound, S1. It marks the beginning of ventricular systole. It's a high-pitched sound, which produces the classic lab sound of the heart. It occurs due to the closure of atrioventricular valves, M1 and T1. More distinguishable during expiration. It is best heard near apex or over mitral area. S1 is usually heard as a single sound without splitting. If we take ECG, S1 occurs just after QRS complex. Auscultation tip. If you find difficult to auscultate S1, palpate carotid pulse while listening. S1 precedes a palpable carotid pulse. Second heart sound, S2, marks the beginning of ventricular diastole. It produces a high-pitched sound, the dab sound of heart. It occurs due to the closure of aortic and pulmonic valves, A2 and P2. It is best heard on pulmonic area or over Erb's point. On ECG, it occurs just after T wave. There is a normal time lag between A2 and P2, which is 30 milliseconds, so we hear S2 as 2 sounds, which is called splitting. Splitting can be physiological splitting, or pathological splitting. Physiological splitting is heard during inspiration, when there is an increased venous return to the right side of heart. This will take more time to fill the right ventricle. As a result there will be delay in closure of pulmonic valve, hence the splitting of S2. Wide splitting, fixed splitting and paradoxical splitting are pathological splitting of S2. Wide splitting is seen in conditions that delay right ventricular emptying, such as right bundle branch block, pulmonary hypertension etc. It is more distinguished during inspiration and less during expiration. Fixed splitting is heard both during inspiration and expiration, hence the name fixed. It is caused by atrial septal defect. Paradoxical splitting. It is more clearly heard during expiration. It precedes A2, hence the name paradoxical splitting. It is caused by left bundle branch block, aortic stenosis, severe hypertension and left-sided heart failure. Third heart sound, S3. Occurs early in ventricular diastole in the setting of ventricular dilation. The rapid filling causes turbulence to the blood flow, hence, generate the sound S3. It is best heard near apex or over mitral area, during expiration. It's a low-pitched sound, so use the bell of stethoscope. This sound is best heard in partial left lateral recumbent position. On ECG it occurs just after T wave. This sound is normal in young, healthy athletes, abnormally found in patients with systolic heart failure and dilated myocardiopathy. Fourth heart sound, S4. By the end of ventricular diastole, ventricles are nearly full. Atrial contraction further stretches and fills the ventricles. The vibration caused by this filling and stretching generates the S4 sound. S4 precedes S1. It correlates with PR interval on ECG. Best heard near apex, over mitral area, easy to auscultate in partial left lateral recumbent position. Normally heard in young, healthy athletes, abnormal in patients with diastolic heart failure, aortic stenosis and hypertension. Apart from these normal sounds there are some other abnormal heart sounds that we should know. Like, opening snap. Normally opening of valves are inaudible, however, if the mitral valves become stenotic or narrowed, they create an opening snap. Systolic ejection sound, also known as ejection click, is due to the opening of stenosed aortic or pulmonic valve. Finally, mid-systolic click, caused by the prolapsed mitral valve leaflet. If you like this video, don't forget to like, share and subscribe the video.